This lecture in anatomy and physiology will be cardiovascular, heart. So this is an overview of this lecture, and we're going to be talking about the anatomy of the heart in some detail. We will talk about the pericardium and the cardiac wall. We will talk about chambers and valves, coronary arteries, the great vessels, conduction system of the heart, as well as systemic and pulmonary circulation. Let's talk about the pericardium. The pericardium is basically a membranous covering that covers the heart. And it consists of two layers. You have the visceral pericardium and the parietal pericardium. So the visceral pericardium is the inner layer, which is tightly adherent to the heart. So this is your visceral pericardium. Your parietal pericardium is the outer layer. The pericardial cavity is located between the visceral and parietal pericardium. And typically this space, this cavity, is almost non-existent. And of course, on the outside, there's a fibrous pericardium that's attached to the parietal pericardium. And typically when cardiac surgeons do surgery, they have to incise the fibrous layer of the pericardium along with the parietal pericardium in order to expose the heart. Now let's look at the cardiac wall. The cardiac wall consists of three main layers. There's the endocardium, which is the inner layer, and it's lined by a single layer of squamous epithelium. You have the myocardium, which is the muscular portion of the heart. It's the middle layer. It consists of cardiac muscle, and it's by far the thickest layer. And it's thicker in the ventricles than the atria. And then you have the epicardium. For the sake of completeness, it's the outer layer, and it's synonymous with the visceral pericardium. Now let's talk about the heart chambers and the valves. Now here are the chambers of the heart in order of blood flow, which we will talk about later. You have the right atrium, the right ventricle, left atrium, left ventricle. So you got blood returned to the right atrium, goes into the right ventricle. You pump blood out the pulmonary artery into the lungs. The blood gets oxygenated, comes back through the pulmonary veins into the left atrium. Left ventricle goes out to the aorta to the rest of the body. And here are the valves. You have your tricuspid valve, which is aptly named so because of the three cusps on the valve, although you can't really see it that well here. You have the mitral valve, which is also known as the bicuspid valve because it has two valves. That's located on the left side of the heart. So tricuspid is on the right side of the heart, mitral valve is on the left side of the heart. You have your pulmonic valve, which is at the root of the main pulmonary artery. That has three cusps. And you have your aortic valve, which is also at the root of the aorta, and that has three cusps. Now let's talk about the coronary arteries. So the heart is an organ, and like all organs, they need a blood supply. And the heart not only pumps blood to the rest of the body, but it pumps blood to itself too through the coronary arteries. And there are three main coronary arteries that are clinically important. Two of these coronary arteries are given off by the left coronary artery, which is also known as the left main coronary artery. It gives off the left anterior descending, which in some textbooks may also be known as the anterior interventricular artery. I actually never saw that term used until I reread an anatomy book. And you have the circumflex artery. So you have your LAD, your left anterior descending, and your circumflex. And then you have the right coronary artery. The reason I say these are clinically important is because whenever we develop atherosclerosis of the coronary arteries, these are some of the arteries that can be affected, and these are the arteries that can be fixed, either by an interventional cardiologist or a cardiac surgeon. Let's talk about the great vessels. And they're called great because, well, I mean, they're great. They're great in size. So let's talk about the superior vena cava and the inferior vena cava. So here's your SVC. It's superior. It drains blood from the head and the arms and part of the upper body. The inferior vena cava drains blood from the lower body. You have your pulmonary trunk, also known as the main pulmonary artery. So this right here is a pulmonary trunk. It bifurcates into the left and right pulmonary artery. The left goes to the left lung. The right pulmonary artery goes to the right lung. So deoxygenated blood is pumped through these two arteries into the lungs, and it gets oxygenated. You have 4 pulmonary veins. You have the 2 left pulmonary veins, 2 right pulmonary veins. And these bring oxygenated blood into the left atrium. And of course, last and definitely not least, the aorta. You got your ascending aorta, you got your aortic arch, and then you have your descending aorta. Conduction system of the heart. So not only does the heart have its own blood supply and give off a bunch of great vessels, but it also has its own conduction system. And cardiac contraction is due to the propagation of an action potential, which is depolarization throughout the heart. So your heart beats because it can generate its own electrical signal. So basically, an electrical impulse travels down the heart and causes it to squeeze, therefore pumping blood out of the heart. As I already mentioned, the heart has its own conduction system, which allows it to beat independently. So even if the nerves to the heart are all cut, it will continue to beat. And this is especially true of a heart transplant, because when you remove a heart from a donor, you cut the vagus nerves to the heart. And then when you transplant it into a live recipient, the heart still continues to beat. So yeah, the heart can beat on its own. Let's look at the components of the conduction system. You have your sinoatrial node, SA node. So an impulse is generated here. It travels down and encounters the AV, atrioventricular node. Travels down the AV bundle, which is also known as the bundle of His. Divides into right and left bundles and conducts through the Purkinje fibers. So you got an action potential that propagates down the heart and causes the heart to beat. And this is not by accident. So the atria contract, then the ventricles contract, and blood is pumped out of the body. Let's talk about the systemic and pulmonary circulation, because functionally speaking, we have 2 circulatory systems. Let's start with the pulmonary circulation. The pulmonary circulation is also known as right-sided circulation because the right heart chambers function to pump blood to the lungs, the pulmonary system, which is why it's called pulmonary circulation. So this is how it works. The right atrium receives deoxygenated blood from the superior vena cava and the inferior vena cava. Once it receives this blood, the right atrium pumps this blood into the right ventricle, which in turn pumps the blood through the pulmonary arteries to the lungs. Once this blood reaches the lungs, the blood is oxygenated. Once the blood is oxygenated, it returns to the systemic circulation. The systemic circulation is known as the left-sided circulation because the left heart chambers function to pump blood to the rest of the body, which is systemic. So the left atrium receives oxygenated blood from the pulmonary veins, which are draining the lungs. The left atrium pumps this oxygenated blood to the left ventricle, which in turn pumps it through the aorta into the remainder of the body. And the body extracts oxygen and nutrients from this blood. And then the cycle repeats. Once the blood is deoxygenated, it returns back to the right heart, and the story continues. It's finished. We're done. Like this video, subscribe. Thank you.